Hello everyone, welcome to Mediverse Atlas, and in this video we'll be discussing an important topic of physiology, that is myocardial infarction. So what is myocardial infarction? So this is nothing but it is obstruction to the blood flow towards the heart. So myocardial infarction, what does infarction mean? Infarction means there is ischemic cell death that occurs if ischemia is prolonged. What is ischemia? So ischemia means whenever there is a decreased tissue perfusion, if the particular organ or tissue is getting decreased blood than the normal, then that is called as ischemia. And if the ischemia is prolonged, it leads to infarction. Okay, so this is about the myocardial infarction. That is nothing but decreased blood supply to the heart. Okay, so what are the causes? What is the reason for the infarction? That is, if the obstruction is more than 75% in the coronary arteries, then it can lead to myocardial infarction. Okay, so what are the obstructions? So the obstruction may be caused due to various reasons. What are those? Let us study. So what are the causes of infarction? That is very much important. Okay, so the infarction may be caused due to any spasm in the coronary artery in the site of atherosclerosis. Okay, the another cause of the infarction or the obstruction may be because of the platelet aggregation. So the platelet aggregation in the blood vessels or hemorrhage in the arteries, this can also lead to obstruction, that is leading to decreased blood supply to the heart, that can lead to myocardial infarction. Okay, what are the other causes? That is increased serum levels of lipoprotein A, C-reactive protein, troponin I, and homocysteine. These four are not the causes. Actually, these are the indications of myocardial infarction. So the elevated levels of this substances in the serum, that indicates that the person is suffering from heart problem, that is myocardial infarction. So these are nothing but the factors that contribute, or the factors that recognize the myocardial infarction in the biochemistry. Okay, so what are the symptoms, what are the signs that we get to see in the myocardial infarction? The symptoms that the patient says is that the severe chest pain that radiates along the ulnar border of the upper arm, left upper arm. Okay, on the medial aspect of the left upper arm, it radiates to forearm as well as in the hand, associated with excessive sweating. Okay, so these are the symptoms that the patient says, whoever is suffering from this myocardial infarction. Okay, so these are the clinical features that a person sees, the person is associated with in the myocardial infarction. Okay, so in the exam they can ask you the clinical case, and they can mention you the following clinical features, and they can ask you the what is the diagnosis of the that a person is suffering from. So you're supposed to identify it correctly by means of these clinical features that are specific to myocardial infarction. Okay, let us understand about the diagnosis of myocardial infarction. So how do you diagnose a person suffering from myocardial infarction? So you can't directly go for the treatment just by listening to the clinical features, listening to the what the patient is saying. We should undergo investigations. Okay, we should make the patient undergo ECG. So what is the ECG tell about the person? So in order to understand this ECG, abnormal ECG, we need to understand the normal ECG. So if someone has not watched that video, please do watch it. It is in the link in the description. And the ECG, the typical ECG changes in the myocardial infarction is that there is a elevation of ST segment. Okay, so the ST segment elevation occurs in the myocardial infarction, that we can observe in the diagram. So this is the normal ST segment in the normal individual, and this is how the red line indicates the person ECG who is suffering from myocardial infarction. Okay, so there is a elevation of ST segment. So ST segment depression is seen in the leads opposite to the side of infarction. So we know very well, whenever the ECGs has to be examined, the person is uh, made to wear the leads, right? So the leads that are opposite to the infarction, in that leads, from that leads, if we take the ECG, and that leads, we get to see the depression in the ST segment. So in the exam, they can, in the clinical case, they can give you ST segment elevation or ST segment depression. So in both the cases, you have to directly assume that it is myocardial infarction. Okay, don't get confused in this. Now, what are the changes in the plasma? What are the changes in the enzymes that are present in the plasma? So in the myocardial infarction, decreased damaged myocardium releases enzyme in the blood. Okay, what are those enzymes? The first one is creatine kinase, then comes the lactate dehydrogenase, and then their isoenzymes LDH1 to LDH5. There are various isoenzymes of LDH, right? So this LDH1 is elevated in the myocardial infarction. Okay, so this is released whenever the myocardium is damaged. So it starts releasing the enzymes that are indicative of myocardial infarction in the serum. Okay, so this is one of the detection that we can do. And how do you confirm the diagnosis? That is important. So, if you are still in doubt whether the patient is an MI or if it is other disorder, like, so how do you diagnose that? So for that you need to take nitrate tablets. You need to give nitroglycerin or nitrate tablets to the person suffering from MI. So why to give that? If the person feels a sigh of relief after intake of those nitrate tablets, then it indicates that the person is definitely suffering from myocardial infarction. Even after intake of the tablet, if the patient is not having any kind of betterment in the condition, that indicates that it is not MI, it is some other disease. Okay, and you can confirm the diagnosis by doing coronary angiography. This is the ultimate diagnosis that you give to the patient suffering from myocardial infarction. Okay, just to diagnose whether it is correct diagnosis or not. Now let us talk about the treatment to be given in the myocardial infarction. And what is the physiological basis of the treatment? You need to know the treatment as well as you need to know how the treatment uh, improves the condition of the patient. Okay, so the first one, the most common treatment that we give is nitroglycerin. Okay, what is this nitroglycerin? This nitroglycerin, it is a vasodilator. Okay, it dilates the blood vessels. Suppose if this is the uh, vessel of a person who is suffering from the infarction, and suppose this is the obstruction, this red color is the obstruction. Now, if you give the vasodilators, it leads to dilatation of blood vessel, right? And in this way, the obstruction is, not completely blocking the vessel. Okay. So this vasodilator is given, which decreases the afterload as well as the preload. Okay. It causes vasodilation means it affects both arteries and veins. It causes the dilatation of arteries. It causes dilatation of veins. If there is arterial dilatation, there is decreased afterload. Okay, if there is venous dilatation, there is decreased preload. So what happens because of that? So this leads to decreased oxygen consumption of myocardium. So if there is vasodilatation, there is dilatation of the blood vessels that will lead to decreased cardiac output. Okay, that leads to decreased afterload and decreased preload. Now, what will happen because of this? This can lead to decreased oxygen consumption of myocardium. Okay, so if our oxygen consumption is less, that means the heart is not getting much workload. Okay, this improves the heart function. Okay, in some way we are relieving the heart. Okay, we are giving less workload to the heart. The second treatment that we give is streptokinase. This streptokinase is given. Suppose if the obstruction is caused due to any clot or the platelet, then at that time the streptokinase has to be given. Okay, the streptokinase, it is also called as the clot buster. Why it is called as clot buster? Because it causes the lysis of clot that is present in the coronary arteries. How it causes the lysis? The clot consists of plasminogen, which converts the plasminogen into plasmin, and it causes the fibrinolysis of the clot. Okay, this you have to relate with the hematology. So this is about the action of streptokinase. Then the coronary angioplasty. Okay, angioplasty is nothing but removal of the obstruction in the coronary artery. That is also one surgical procedure done in treatment of MI. Okay, one of the method. The next one is the calcium channel blockers. What is this calcium channel blockers? It causes the coronary vasodilatation. Okay, then low dose of aspirin can also be given. Okay, but it has to be given in the lesser dose. It inhibits the, what is the physiological basis of giving aspirin in the person suffering from myocardial infarction? This also can be asked as a reasoning question. So this aspirin, it inhibits the cyclooxygenase. Okay, so this cyclooxygenase, it inhibits the cyclooxygenase, and thereby it leads to the formation of TXA2. It is a prostaglandin. Okay, So when you inhibit cyclooxygenase, it leads to TXA2 formation that decreases the platelet aggregation. If there is decreased platelet aggregation, then there is lesser obstruction. The obstruction will be lesser, or it can reduce the causative agents that is causing the obstruction. Okay, that's why the aspirin has to be given in the lesser dose. Now, the last treatment that we get to see is the folic acid and vitamin B12. Okay, this folic acid and vitamin B12, it converts the homocysteine to methionine, which is a non-toxic compound. So we know very well that this homocysteine is elevated in the person suffering from MI, right? So for that, that's the reason why vitamin B12 has to be given in patient who has elevated homocysteine levels, which converts the homocysteine into methionine. Okay, and this methionine is lesser toxic or non-toxic compound. So this is all about the physiological basis of treatment. So, in myocardial infarction, the clinical case will be a structured clinical scenario in which the clinical features in the myocardial infarction will be mentioned in the question. The first question is they'll ask you the diagnosis, then they'll ask you how do you diagnose the patient, what are the physiological basis of treatment, and what is the pathophysiology of myocardial infarction. So these are the subheadings, sub questions that you get to see. Okay, so this is how you should answer in the exam. I hope this is clear, and thank you.